Dr. Brent, Linda,
Hi there.
I am so glad we are here together. I must confess, I was really looking forward to seeing you today. I could not wait virtually. I was thinking, okay, 5 more minutes. I know that you have been working on the topic of neutering and spaying of dogs. What were your early influences that led you to the career and particularly focusing on pet sterilization, neutering
Yeah.
and spaying?
Well, I guess overall, anybody who's ever known me knows I'm like absolutely crazy about animals. I mean, that's me. Linda's the animal person. And I decided rather than going down the veterinary medicine path, I decided to go down to, more of a animal welfare, animal behavior type of plan, and always had a passion for primates, and actually went to my undergraduate through my PhD studying mainly chimpanzees. My whole early career is in studying the behavior of chimpanzees and other primates, and started a nonprofit organization called Chimphaven, which is a sanctuary for chimpanzees located in Shreveport, Louisiana. It's now the largest sanctuary for chimpanzees in the world. Very
Wow.
proud of all the accomplishments of the organization. And I kind of retired, so-called retired from there, and decided to shift gears a little bit back from working mostly as an administrator back to doing some more research. And so now I'm the executive director of a very small private foundation out of the Bay Area called the Parsimus Foundation.
Yes.
That is where I really started shifting over to pet work, as well as our organization also does a lot of work with humans. We work on very innovative but neglected medical research, hoping to help both humans and animals in terms of health and welfare. Topics are very diverse. If you visit our website, the kind of stream that goes through is a focus on sterilization and contraception in both humans and animals. I've been there now, probably over 10 years, and we've been one of the people at the forefront of trying to come up with better ways to sterilize pets, dogs and cats mainly. I've been involved in this area for a long time, very passionate about it because I'm absolutely in love with my dogs. So,
What kind of dogs do you have?
right now I have a beagle who's just a year old and quite a terror, actually, but he's cute as anything. And then I have an 8-year-old dog named Toby, who is part American Bulldog and part Treeing Walker Coonhound. So, but I've had lots of different
Nice.
breeds in the past, a lot of
Nice,
hunting dogs, spaniels, and things like that.
So what was the driving force behind establishing the Parsimus Foundation?
The foundation was established by Elaine Listener, and really it's kind of her brainchild of originally trying to get new male contraceptives out on the market. And so that was the original main goal. And then it's just kind of branched off from there into animals, but also into other areas. She's very, very innovative, and she keeps abreast of a lot of different areas of research. And so a lot of our topics are directly related to her interest areas. And when she sees something that needs attention, most of our work is not something that a pharmaceutical company is going to pick up because there's no profit margin in it. And so she wants to get the word out that inexpensive, non-patentable methods can be very effective.
And that's the problem, right, with patents, because if it's not patentable, then it's not good enough for anyone to put money in.
Yeah.
I've always dreamed of a world where the government would actually sponsor heavily all this research that would be inexpensive when it comes to healthcare and well-being of animals and people. The business model actually doesn't work. It may work in car industry or rockets, but it doesn't really work in medicine. And I would love to actually, research is amazing. And I many times throughout the course of my work, I was thinking it would be so much fun. Like I have so many ideas for research and so on. So I'm not sure whether it'll happen this lifetime, but I'm definitely understand your passion. That's for sure. What challenges have you identified in conventional spaying and neutering methods, and How do they impact pet health, dog's health, cat health?
There's a lot more research done on dogs than on cats, unfortunately. So fortunately or unfortunately, depending on whether you're, have dogs or cats. But
There's the behavioral issue, right, with male cats, with tomcats, because
yeah,
they would destroy your house and make it smell like a
yeah.
litter box. So that's that's definitely not a good idea. But some dog lovers live with cats, and eventually we may actually talk about cats too, to what to do, because they'll be probably asking. Even though I'm focusing on dogs as well. So, what challenges have you identified in the conventional spaying and neutering?
The biggest issue is really people don't think about spaying and neutering as affecting their dog's hormones. I mean, basically, you're removing the sex organs from the animal, and so it can no longer produce the kinds of hormones that any normal animal would have throughout most of its life. We're all taught, ever since I was little, I always remember everybody spays and neuters their dogs. In fact, what is it? 60 to 80%,
in North America,
depending on
in North America, right?
Yeah, in America, not everywhere.
It's not, not everywhere.
It's such a standard in this country, in North America in general. It's such a standard that people haven't really come to grips with the idea that there might be health implications to doing this. Think about it. If you were talking about a human and you had a 2-year-old kid that for some disease reason lost the ability to have a normal endocrine system or normal hormones, well, that would be a big deal, right? You'd know that the kid would need to have the right kind of hormones to grow and develop and not have diseases and all of that. So it's funny when we think about our pets that we don't also consider that the same issues come to play. If you take the hormones, the natural hormones out of the dog, there's probably going to be some kind of long-term health implications.
Consequences.
And the research is interesting because, we really, in the US, we really didn't start like massive wide-scale spay and neuter until the 60s, early 70s, when pet overpopulation became such an issue. So it hasn't been all that long. And it was years before anybody even started really doing a lot of research on this topic. And it's exploded in the last, I would say, 10 or 15 years, where we're really, really honing in on some of the issues that are most problematic, which I would say are serious, like cancers, all sorts of cancers, joint issues. These are debilitating, life-ending
serious diseases
issues that happen much more commonly in dogs that are spayed and neutered than in intact dogs. So the other issue that I think is difficult with the question is it's not all or none, right? There's lots of impacts depending on how large the dog is, what breed it is, it's a genetic background and things like that can make a difference in whether there is much of an impact of spay or neuter. It makes it a little more complicated for people to understand, but I think it's pretty clear to most people who are familiar with the literature that there are serious health implications. And that word is getting out to the general public when they consider, I want to do what's best for the lifelong health of my pet.
As you're talking, I'm thinking about how much hormonal health plays a role in human life as well. And, there's a huge focus with some of the health gurus and medical doctors and vloggers and podcasters. Dr. Attia is one of the people that I remember off the top of my head. I'm so grateful that you actually have been addressing it. And there's someone who takes it on, because quality of our pet's life is super important. I'm going to be honest here. My 4-year-old dog, Pax, has been neutered. I'm a sleepwalker. I sleepwalk through glass door. I almost died by cutting one of my arteries in my leg. So I am basically eligible for a service dog. And when he was trained, they told me that basically there's no way he can be unneutered and that he had to be neutered. So we neutered him. And while he is still happy and relatively strong, I definitely have seen some changes. And especially on the musculoskeletal level, that I see that he's much more injury prone than he was before. And he's like he's strong and robust and so on. And I still see that he's much more injury prone if he overdoes it. I'm sure there's many dog lovers and cat lovers who would like to know what to do about that as well. Can you explain to our viewers and listeners about the hormonal axis, like, from the hypothalamus to pituitary gland to the testes or ovaries? Can you explain a little bit about the hormones so people understand how it works and why we are seeing these challenges when we remove the testicles?
It probably is something that people don't quite understand, because while the testicles or ovaries are the organs that would produce the hormones, there's a whole cascade of chemical reactions that have to happen to have that work. As you said, starting with the hypothalamus, and that influences the pituitary gland, and then that puts chemicals into the blood system that would tell the ovaries or the testes to actually produce estrogen or testosterone or not. And so what happens when you take those organs away is that the system keeps going because there's no feedback from the hormones being in the body to tell it to stop. And so one of the products of that is something called luteinizing hormone. And that's one of the signaling chemicals that tells the organs what to do. But it's called a feedback loop. And when that feedback loop is disrupted because you stopped the feedback of the normal hormones starting, it just grows and grows and grows. And so one of the collaborators that I've worked with very closely, Dr. Michelle Kutzler, has been on the forefront of trying to understand the mechanism of why spay and neuter would have a negative effect. And so she's actually found that that luteinizing hormones aren't just for sexual function. There's a luteinizing
and hormone production and ovulation, right, and so on.
Yeah, these receptors are in many tissues in the body, and so when you have something so out of balance that it just can totally drive tissues to do things that they're not supposed to do.
I imagine this, like when the testicles ovaries are removed, it's like a leaking toilet, basically. Like there's a constant flow of the hormone, the LH, because there is no stop, right?
Yeah.
Like there's
nothing to tell it to stop producing.
Exactly. Regular toilet would stop like when it gets to the level, so that little gauge, right? But because the pituitary gland doesn't register any testosterone or estrogen, it continues to pump the LH in the bloodstream, and it has side effects.
Yeah.
Could you explain the concept of hormone-preserving sterilization and its benefits over traditional methods?
Yeah.
How could it be done? What do you recommend? Do you recommend all dogs kind of like running around and breeding uncontrollably, or do you have a solution for this dilemma?
I think it's pretty clear that other than in certain circumstances, like, breeders or people that use dogs for conformation or sporting or whatever, most people are going to need to get their dogs sterilized. We already know, especially in the United States, that it's very easy for it to get out of control. And then we have pet overpopulation and massive impacts, negative impacts on welfare and
suffering. Yeah, absolutely.
There's simple options. Instead of removing the ovaries and the testicles, you can remove or impact the ability to reproduce without messing up the hormones. So we call it hormone-sparing sterilization. Some people, for females, say ovary-sparing spay.
Yes.
And that's simply a hysterectomy. It's, you've got the uterus, and without a uterus, the dog cannot reproduce. You leave the ovaries intact. So the entire uterus is removed, and including the cervix, so that there's no chance of pyometria. can be a life-threatening disease issue that can attack dogs. And one of the reasons that veterinarians often say you should get your female spayed. Well, there is a way to sterilize your pet without removing the hormones and still protecting from pyometra.
So when it comes to the two options, whether you either do tubal ligation or remove the uterus, like you're for removing the uterus.
Yeah.
Has anyone done studies on the rate or frequency of pyometra in dogs that would have, let's say, tubal ligation and wouldn't get the uterus removed? Has there been any studies? Have there been any studies?
Not that I know of specifically on that topic. I don't know that it would be any less with tubal ligation than with an intact dog. And because it can be so life-threatening, and a lot of times people don't realize that it's,
it's happening, right?
Doesn't have a lot of symptoms sometimes until it's serious.
Yes.
We prefer to recommend, removal of the uterus or hysterectomy rather than tubal ligation. And in all of our conversations with veterinarians, I think it would be tough to find a veterinarian that would recommend tubal ligation instead.
And when it comes to blood spotting in female dogs, does it happen when the uterus is removed?
Not if it's done correctly.
Right? Yeah.
So,
because it can be the stump can actually bleed, right? Like if it's
just like you can get stump pyometra, right? I mean, that's why it's really important that the veterinarian has experience and understands that all of that tissue has to be removed. We're contacted sometimes by individuals who say, "Hey, I had this done and a month ago and my dog's still bleeding." Well, there is going to be some residual after a surgery, but if you're still having the problem later, and especially if the dog is showing spotting at a regular interval, like it would be in heat, then it would probably make sense that the dog would need to be looked at again to be sure that there are no tissues left there to be of concern.
It has to be done as close to the cervix as possible, right? Obviously not removing the cervix, but as close to the cervix as possible.
And we have a lot of information on our website, including some videos and discussions and papers specifically for veterinarians if they're interested in learning the techniques, if they haven't been familiar with them in the past. We also, through Parsimus Foundation, have a number of veterinarians that are willing to advise specifically to new vets that are interested in it. So we give a lot of support to people so that they can, move into this new area if it is new to them.
That's amazing. That's amazing. I'm so excited about the tide changing.
Yeah.
So I know that you've done a hormone therapy study. What were the key health improvements observed in the neutered male dogs? That's the first question. And second, are there any negative side effects? Like, is there any increase of, let's say, prostate cancer or something like that? Because we know that in human males, prostate cancer is quite prevalent. And some veterinarians also are saying that if a dog is neutered, that prostate cancer doesn't happen, right? That's what we've been taught. So I'd like to know first about the hormone therapy case study, and then if there are any negative side effects of the therapy.
Well, just to be clear, so for male dogs, prostate cancer is actually higher if they're neutered. One thing people need to know, there are benefits to spaying and neutering. So you would have protection of, say, testicular cancer or ovarian cancer, right? Because they don't have testicles and they don't have ovaries. Yeah. And there are protections for some prostate diseases. But for male dogs that have already been castrated and have had hormone therapy after that, because they've had some kind of health issues or whatever. So they've basically been returned. Their hormones have been restored to a more normal level. The main thing that you need to watch for, because he doesn't have testicles yet at all, is any prostate issues. In the case of the work that we've done, the study that we did was actually on my dog. It was just a single case study. It's the first published information on using hormone therapy in a male dog for something other than incontinence or dribbling urine. There's not a lot of literature out there. And so the one thing that I watch for my pet, who's now been on testosterone therapy for 4 years, Yeah, he's 4.5 years. He's 8.5 now.
Mm-hmm.
Is that when I take him for his annual exam with the veterinarian, I make sure that he has at least a manual prostate exam. And as he
Mm-hmm.
gets older, when you would expect the prostate to grow, like it does in humans, and potentially cause problems, you can have an ultrasound or other diagnostics done just to double check that there's no issues going on.
But there are also some other ways of preventing cancer in general, right? Like good nutrition, some supplements, herbs, turmeric, all those are really key in preventing cancer overall. And I think that we have learned a lot about how to address these risks and lower them. But so Toby is 8.5, and when you kind of go back to 4.5 years old, when you put him on the hormone replacement therapy, and now how is he aged? Like what are you seeing?
Oh, he's perfectly fine. I mean, honestly, there have been absolutely no side effects from the testosterone therapy. And to be clear, he's on a weekly injection just with a insulin needle. So it's incredibly small and a tiny amount.
Yeah.
And he's about 70 pounds. So, and he's also been on a GnRH agonist. Because
yes, that's what I was going to ask you.
This is really interesting because, and this is probably where you find individual and breed differences. So as a castrated male, when I did all the hormone, evaluation for him, we measured luteinizing hormone. His was in the 80s. I mean, the normal range for a male dog is like 0 to 3.
Oh my goodness!
For an intact dog, even for a neutered dog, like the high end would maybe be 20, and his was 88. And so even when we put him on the testosterone therapy, it still was outside the normal range. It went down to 30, but it was still high. And so with the GnRH agonist, gonadotropin releasing hormone agonist, it kind of overstimulates the pituitary and it stops that flow of LH. And so now his is down to a normal level. And I haven't, I get his blood work done regularly, and I don't check his hormones any longer, but because he's been on a standard dose all this time. But I haven't had any issues at all. And the change in him, like you had mentioned, your dog, and some changes after being neutered with just body composition and ability to move. Toby was, I got him from the county shelter. They make you spay and neuter him before you can even bring him home. So he was young. They thought he was around 7 months. And he was neutered at that time. And literally within a couple of months, he radically changed. He was just your typical friendly, skinny puppy running around. And then by the time he was a year old, he had massively gained weight. His right hip was so bad that he couldn't, he couldn't run at all. He couldn't, like a dog jumps up on you. He couldn't do that. He was in constant pain, and he became horribly anxious. He was petrified that we couldn't take him anywhere. He was so scared of everything. And so we spent the next 3 years, like many people do, trying one therapy after another. He had been on all sorts of medications and training and, diets and everything without any influence at all. Nothing helped him. I was really lucky. Because of my job, I was familiar with this background and knew some veterinarians who could counsel me and help my local veterinarian to start this regimen of testosterone therapy on him. And I'm not kidding, within a couple of months, his entire body composition changed. He had become just emaciated in his hips because he just couldn't use his legs very much. And within about 3 months, it was entirely noticeable how his ability to move became better, and he started running around. And it was interesting because at about the same time, we had gotten a new dog that was younger than him, who wanted to play. And the thing that really just broke our heart was that here we have this dog who's not old, but he couldn't run. He couldn't hardly play. He was limping, and we had him on medicine, pain medicine all the time. It was awful. And then within a couple of months, totally changed. And you wouldn't even know it now. You would never know that he even had any kind of hip issues. The weight issue stabilized. He's very food motivated kind of boy. So, it's something we struggle with. But it wasn't this continuing to ramp up problem. And he's okay. His anxiety took longer to come around, I would say, several years. And that's probably also due to just, as you were saying, lots of things influence health and especially behavior therapy and nutrients and putting him on a different diet and things like that probably helped. And today he is in better shape today than he was when he was a year and a half old.
That's amazing. And, I also think the early spay and neuters are even more damaging, right? Because the development of muscles and skeletal changes all really affect them.
There's a recent study that Dr. Chris Zink published just recently, last year, I think, that looked at intact dogs, spayed or neutered dogs, and then it's the first study to actually look at dogs that had hormone-sparing sterilization. Smaller group because there's not as many that have gone through that. But the outcome was really clear. Dogs who had access to normal hormones for longer in their life had much fewer health complications and lived longer.
Are there any, behavioral changes if you start replacing testosterone? And we're talking male dogs. Like, first, are there any changes in behavior? Do they become more aggressive or more territorial? Is there anything like that?
Now, for my dog, the only behavioral change we noticed, because we have two dogs, was that he started mounting the other dog, but it was a kind of transient. It didn't last. After he kind of got used to the testosterone, he stopped doing that. I haven't noticed anything else in terms of behavior.
How about changes in their hair coat and skin health and all that? Have you seen any differences as well?
I don't know that I've seen differences. He has very healthy, shiny, nice hair. It's also partly with supplements. He's on fish oil and some, fatty acid stuff, to help his joints. And that I think also has an impact on his coat. But I know there's a lot of, it's a huge problem for people that show dogs, right? Or need to, that's part of the reason why they don't want them to lose their natural hormones, because in a lot of breeds, it makes a huge difference in the coat quality if they don't have normal hormones.
Now, about female dogs, do you do hormone replacement therapy as well?
Our foundation hasn't done any studies on that yet because female dogs get incontinence quite frequently when they're spayed. And so there is at least a small body of literature on using various types of estrogens and sometimes GnRH agonists to reduce the LH again. And that does help. In fact, it's pretty... I think for most dogs, you can pretty much get things under control by replacing what they lost. In males, it doesn't seem to work quite as well, at least with the little bit of literature there is in males. But because of that, at least veterinarians are usually familiar with the concept. And so we hope that if a female dog is having similar problems to what, my dog had, that I think if you go to a veterinarian, you're going to have an easier time potentially finding a veterinarian that would offer hormone therapy for your dog if it's a female. There's just such a lack of knowledge in the males that is why we kind of concentrated in that area.
I always thought that incontinent females have some sort of subluxation as well in the lumbar sacral area. And I thought it was just because they were stretched on the surgical table or something, and obviously hormonal changes as well. But now when I'm thinking about it, the instability of that region could have been caused by the absence of the hormones, right? So it's not like basically they become unstable and they become more prone to the lumbar sacral issues that I've seen in dogs that are incontinent as well. And interestingly enough, I have a protocol that has worked for incontinence without replacing the hormones. But now I'm thinking, now I'm thinking it's probably better if we do, right? So how do you plan to raise, or how have you been raising awareness among pet owners and veterinarians about the alternatives to traditional sterilization?
Just any way we can. We've gone to a lot of veterinary conferences. I've given a presentation about this with other veterinarians talking about hormone-sparing sterilization. Our website, which is just parsemus.org, parsemus.org, has tons of information. And even if you Google any of this, you'll find us, because we're one of the main repositories of research and really basic information about these issues and about hormone restoration, at least in males. The other thing we do is we fund studies, and we try to encourage people to try things, veterinarians, get the word out. We have a whole list, a veterinary directory of people who offer alternatives to traditional spay and neuter, as well as other kind of alternative procedures. So we have a vet list, and we email them regularly and say, hey, do any of you do this, because we have a need, or whatever. So
nice. That's really amazing. And if people wanted to support your organization as well, they can go to Parsemus. What is the website again?
Just parsemus.org.
Okay, great.
Yeah.
So just to kind of recap, when the testicles or the ovaries are removed, the pituitary gland and the gonadotropin from the hypothalamus get out of balance. And what you do then, replace the testosterone in male dogs, but also use gonadotropin agonist, which basically suppresses the production of the luteinizing hormone, right? So, and without that, it would not work as well.
A lot of people have asked us, could you just reduce LH? Would that make the difference? And I think it depends on what the problem is with your dog, right? My dog had a joint problem, and the testosterone helped to build his muscle, which is obviously supporting that joint.
Absolutely. And tendons as well, connective tissue, right?
Yeah. So I think for my particular dog, I think both issues were needed and are probably important for his long-term health. But it's a really cool question, because I'd love to be able to do more research on that topic and see, really try to tease out what could be a really simple solution for people whose dogs are suffering from the impacts. I can let you know, this is actually the first time we've even announced this publicly, is that we actually have just funded a new study to look at both safety and efficacy of testosterone in castrated dogs. And it's to provide very basic information. And that's because there just isn't anything out there. So veterinarians who may want to try it are worried, like, well, I don't know if it's safe, or what if I give too much, or whatever. So we're going to answer those basic questions. We're going to be able to say, this is how much works. This is how much is too much. This is the kinds of, parameters that you see in the endocrine system at these different levels or dosages. So we're really excited about that. That study should be wrapping up in the spring, and we'll be publishing, of course, the results and spreading that information as widely as possible. Because I think, for veterinarians, they need to have some assurance that what they're going to provide to their clients is not going to hurt them, right, overall. And so I think having that type of data will make a big difference for them.
You said that there is a difference between small and large dogs in neutering and spaying. Like, have you seen larger dogs suffering more or smaller dogs? I suspect I know the answer, but I'm curious to see.
No, I think that the data is pretty clear that larger dogs in general, it's not across the board, but larger dogs in general suffer more from spaying or from definitely neutering. But
and that's what I would definitely see.
I mean, they have a longer trajectory of growth. And so you end up with all sorts of joint disorders when you've, put their whole hormone system out of whack. And I mean, most people, I would say many breeders and a lot of veterinarians now say, if you have a large breed dog, or especially giant breeds, you need to wait, and you want to sterilize them, you need to wait at least 18 months, if not 2 years, until their growth plates have closed on their bones. And so they don't get this, crazy elongation of bone structure, which is the cause of some of the joint disorders that they end up with later on.
I definitely see that in practice, that the larger dogs would be affected more I thought it was just because they were larger, but it would be really interesting to see any changes in lifespan expectancy of the larger breeds, especially, let's say, Bernese Mountain Dogs or
Yeah.
St. Bernards and all that. Like, would they live longer? I suspect that they possibly would.
Yeah.
And that will be a really interesting study
Yeah.
if it's ever done.
And we're just starting to get enough information on some of the common breeds. I mean, there was a study done out of Davis that looked at kind of, retrospective analysis of all sorts of sizes and breeds of dogs. It's really interesting data, and it's a good start. But it's, we're still at an early stage understanding everything. So like I said, it's, you can kind of generally tell people, but the best advice I could give somebody who has a puppy and is wondering, Googling, should I spay or neuter my dog? I think you really need to look at your individual dog, what its genetic background might be. Is it susceptible? Is this a breed like golden retrievers that are susceptible to cancer, or other dog breeds that might have certain, potential problems or that are more common in that breed? And then look at the pros and cons and the risks and benefits of the different methods that you might be able to choose. Some people just probably wouldn't do any kind of sterilization. I mean, if you have a small dog and it stays in an apartment most of the time, or it's on a leash the rest of the time, maybe that's fine and the easiest thing. But that's only for certain circumstances, because everybody's different and every dog is different.
You have the Humpy Chihuahuas in the park, right? But I'm originally from the Czech Republic, and I spent quite a bit of time there now. And one thing that I noticed, predominantly dogs are neutered.
Yeah.
They get along in the park off leash. All the unreutered males, like, they're beautifully socialized. Most of them, obviously, there is some exception. But I definitely see such huge difference in how these dogs behave, how they interact with each other. It breaks my heart to see how many dogs have behavioral issues and have fear and anxiety and aggression and all that. And it may be related to the hormonal imbalances, right?
It's definitely, a lot of behavior problems are more common in dogs that have been spayed or neutered. I've had purebred dogs that, I didn't spay or neuter till they were quite old. And I've had rescue dogs. And one of my rescue dogs, oh my gosh, he was probably neutered when he was just a couple of months old. And when I got him, he was just a little beagle mix, very cute, and didn't have health problems throughout his life, but he developed really awful dementia when he was older. And that's also a behavioral symptom of being spayed or neutered. So, I mean, we basically had to euthanize him because of that. It had gotten so bad. So, all dogs are different. I've also had a rescue dog that was neutered a little less than a year. And we got him around that time. And he died of lung cancer at 5 years old. I mean, it was heartbreaking. I can't even describe how awful that whole thing was for us and for him. And, it's tough. I wouldn't, the little baby beagle that we have now, I'm just not going to neuter him. We just have 2 boy dogs. There's no need. And so I'm just going to leave him alone.
I met Bobby, the oldest dog in the world, this May or June. He was 31, and he unfortunately passed away, but he was unneutered and he lived until 31. It was all verified. Yeah. It was a really interesting experience.
We were also lucky.
He was very lucky, but the owner, the guardian, actually believes that having dogs over 20 is normal.
Yeah.
And so he's done a lot of different things besides feeding food from the garden and from the village, and giving him a lot of sardines and fish oils and so on. It was quite mind-blowing to see this 31-year-old dog acting like he was 16. And so it was just so hard to actually believe for some people. They accused the Lionel, the owner, that he made it up, which he didn't. And it was all verified. And I would love, obviously, everyone would love dogs to live longer. And I can see that there's a light at the end of the tunnel. And we are focusing on nutrition. Yeah. We're focusing on musculoskeletal health. But we have neglected to look at this area. And I'm so grateful that you have been doing that, and that you have just kind of you've been opening the eyes of the veterinary profession. It's lovely to see that you, as a biologist and a PhD and researcher and so on, have kind of come in the industry and just kind of said, hey, in a gentle way, very kind way, saying, hey, why don't you just look at this? This may be a problem, right? And it's just so nice to see. How do you envision the future of pet care, especially in terms of reproductive health?
Well, I think that it's a matter of time before we all think about our pets in a different way. I think we're already on that path where we think of their lifetime health, not oh, it's a vaccine I have to get now and a shot here or whatever. I think people are starting to think, like you mentioned, nutrition. I mean, that is important. And people are starting to realize, well, I can't just give them this stuff in a can anymore, right? Or what's wrong with that? Or, people are questioning. And I think that trickles down to all the different areas of health, just like we think of our own health in many different ways and many things that we can do to improve our health. So I'm very optimistic that we're on the right path and that it is about educating people. And, thank goodness we're in an age where it's easy to find information, and organizations like ours, it's a nonprofit. We are here to help people and also to support the professionals in the area so that they can also learn and grow and offer new things to their clients.
So what advice would you give to veterinarians regarding the discussion of sterilization and options with pet owners, right? What would you recommend?
I would say the concept of being open-minded and giving individual care is really critical. When you're talking about something as important as sterilization, it is not a one-size-fits-all. It just isn't. The quicker people come around to that concept and really take the time to understand each individual client they have and what may work best for them, and looking at the risks and benefits, just like they might with any other type of procedure they would do. I think that's gonna work the best. And it's coming. I mean, the demand, in our opinion, the demand from the public is far outweighs the number of veterinarians who are offering this. So as a veterinarian or even as a shelter, rescue, if you embrace the newer methods that consider individual lifetime health of the animal, you're going to do well. There's an enormous amount of demand from the public. We are contracted every day by people looking for a veterinarian in their town or in their state to do a certain procedure. That's why we have the directory, but it's something, it's gonna be a huge demand that it's gonna separate veterinarians in terms of, the ones that are in the most demand and the ones that aren't.
I have a feeling that we are really nearing the tipping point when things will change. And I'm so grateful to have this conversation. You're an amazing speaker as well. You're clear. It's just like, I feel like I would like to hang out more, and we will definitely get together when the study is done.
Yep.
I definitely, if it's okay, would love to contact you with regards to my dog Pax and just kind of see what we can do, because he's absolutely lovely, and you may have seen him on some of the videos. And
I think he was walking online across the back.
Oh, was he? Yeah. He's but when he was before I neutered him, he had this, like, he was just like, I was just so proud of him, because I thought, okay, I know that I paid attention to nutrition and everything has just turned out perfectly. He had this big mane and he was just beautiful. And so I think I owe him not necessarily apology, because I didn't have a choice in the process and it was just really hard. But I'm also going to work with service dog training organizations, and will explain to them what goes on, and that there may be some other ways of dealing with these dogs, because it's not fair to them.
That's great.
They live with us. They're at our mercy to keep them safe and well. And I really think that we will have to work on this a little more.
Well, they're our best friends. I mean, they deserve no less.
And, you know, like I so would like to talk to you about the primate research as well and everything else that you've done. So I know that we'll connect in the future.
Well, I've greatly enjoyed it. It's been fun to talk to you.
Thank you, thank you. It's just yeah, it's just I love connecting with like-minded people. It's really lovely. So reflecting on your career, what has been the most significant learning and insight regarding pet health? Like if you could put it in a nutshell.
I guess, to be honest, as a learning, I would say don't accept the status quo. I
Hmm.
mean, just because it's something that has been done or people say is the only way to do it, that might not be true. You know, always question, always educate yourself. That to me is the most important thing because that covers all the areas.
Beautiful. Don't accept the status quo. You know, it's so true because when I look at different aspects of veterinary medicine, we've been doing so many things that don't even have scientific or research basis, and we just
Mm,
kind of keep repeating them.
yep.
You know, when you travel around the world and you see a street and everyone sells the same thing, even though they have choices, I find that medicine is like that. Everyone does the same thing and doesn't even
Yeah.
question because other people do that. And there may be different reasons, you know, but I think that this is a beautiful message for everyone. Thank you so much.
Yeah. Thank you.
Dr. Brent, Linda, thank you. And if people want to contact you, that's through the parsemus.org.
Yeah, and if people want to write to us, they can go to our contact sheet. To be honest, I read everything that is sent to us and help. I have lots of phone calls and conversations and emails with pet owners to try to help them. You know, it's where my heart is. So I'll do anything I can to help protect your animal for you.
Thank you. Take care.
All right.
Bye bye.
Bye.